It's a pleasure to be here with a man of so many talents and titles that you have, particularly in the area of cancer treatment and your work on mesothelioma. The last 25 years of my legal practice, I've been dealing with asbestos-related diseases and with mesotheliomas particularly, and know that that's a specialty that you developed. So you're the director of the International Mesothelioma Program.
I started practice at the Brigham and began to see a fair number of mesothelioma cases, certainly because of the shipbuilding industry here around New England. And with that, we began to try to figure out some effective treatments. There really wasn't a standardized treatment for mesothelioma. And I really relied on something my father told me. He was a cancer surgeon. He said, Dave, it's 2 steps. First step, take out all the tumor you can see. Step 2, eradicate the rest of it, the microscopic disease. And the International Mesothelioma Program was begun back in 2002 as a way of putting together all the areas of progress that had happened across the Harvard Medical School and across the Brigham together as a coordinated program focused on the patient and the research that would benefit the patient, and also a support program to help the patient and their families get through what is a difficult time.
Your patients aren't just people that live in the Boston area. You accept patients from all over the country. Tell me how, if I have a client that's in Indiana or Louisiana or Wyoming, tell me how they find out about you and your research and your progressive treatment of mesothelioma.
The website is brighamandwomens.org. And when they get to that website, they'll see the IMP. They can click on it and go right to a very comprehensive web page that will acquaint them with the IMP. There's a number of stories there by patients themselves who've been through the program, and they'll talk a little bit about what they went through and how life's been afterward. So it's a comprehensive website, and I think patients and their families will really benefit from looking at that.
When one is diagnosed, what should they do?
Well, number one, try not to panic. Okay, try to remain calm and realize that mesothelioma is not the death sentence that it was 20 years ago. There is effective therapy, and for the majority of patients who are deemed candidates for an aggressive treatment strategy, quality life extension is possible. And so I would let people realize that we're going to take it a day at a time. And number one, let's get into a treatment program either here or elsewhere in the country that will allow experienced physicians, experienced in the treatment of mesothelioma, approach them as patients in a way that is knowledgeable and aggressive.
Back in the 1980s, when I was first trying asbestos cases, when I would talk to a family that had just received a diagnosis of mesothelioma, the first thing that they felt and the first experience they had was that I have a terminal disease, I have a fatal disease. And it was sort of like they didn't have hope. But I don't know that that's the case today. In mesothelioma, there are a lot of positive things that can be done medically.
The goal of our program, for the program in general, in its research and treatment efforts, as well as for each individual patient, is the following: quality life extension leading to a cure. Quality life extension is available for the majority of patients who are deemed candidates for this aggressive treatment strategy. And when I say leading to a cure, we do have patients now that are 10, 12, 15 years out. Overall, the 5-year survival of mesothelioma has risen dramatically over the past 2 decades. And patients should know that mesothelioma is not necessarily a death sentence. And patients have done it. As I tell the patients, we can't go around this problem, but we can go right through it. We have a roadmap through it, and others have blazed the trail ahead of you. So, number one, I tell patients, don't panic. Let's get a good look at your medical situation and see what can be done. But it certainly isn't hopeless.
When I first started practicing law, and the majority of the clients that I dealt with had their asbestos exposure through heavy industrial exposure or military service and all. And that's where we found a lot of the asbestos exposure, and we still find clients that have asbestos-related disease from those sources. But it seems that when you talk to people today that are victims of mesothelioma, the exposures come from a lot of different types of work areas, school exposures, family exposures. What's been your experience with that as it relates to the disease and the progress that you can make in treating the disease?
We would see probably 80 to 90% of our patients in the late 80s knew where they were exposed to asbestos. Because on every patient who comes through, we take a little questionnaire to figure out where they think they might have been exposed and what their occupation was. Now, only about 60% know where they got it, which means 40% of patients are getting their exposures more likely, more briefly, but nevertheless as effective in causing mesothelioma as some of the ones that you mentioned, refrigeration and so forth. We're seeing a large number of individuals who have either dealt with breaks, we've seen people from schools, and just a variety of different work areas that really need to be looked after. I mean, the composite wall industry, a lot of individuals from that and others that we never saw before.
Doctor, over the 25 years I've been litigating mesothelioma cases.
It's a long time, Joe.
Well, we've been doing this a long time, unfortunately. There's a lot of asbestos disease that's occurred and continues to occur. But one of the things that, from a legal point of view, we must know is it really mesothelioma?
Joe, you touch on a very, very important point. As a matter of fact, it's our first task when a patient comes here for evaluation, and that is to answer the question as affirmatively as we can, one way or the other, do you have mesothelioma? And we have a panel of pathologists here who will review the path from the hometown hospital, which we ask the patients to either bring with them or send along ahead of time, and they'll do what's called immune histochemical staining and other tests to be as sure as is humanly possible that that is what you have.
Talking about new treatments, I've heard you speak several times, and you've come to our law firm and helped educate our lawyers as they're dealing with these issues in the courtroom. And you've talked about hot chemotherapy. And can you tell me just in a layman's term what that is and what that process is?
After mesothelioma is removed, from our studies we understand that the most likely place it may come back is just where we took it out. So even though we don't see any cells left behind, that's where they tend to recur. And so we've focused radiation in that way after surgery and intravenous chemotherapy. But over the last decade, we've developed a technique where we instill in the chest at the time of surgery, after the tumor has been removed, chemotherapy, initially a single drug to prove its safety, and now we have a double drug and soon hopefully be having a triple drug therapy regimen that is meant at the time of surgery to eradicate as much as possible these remaining microscopic cells. And we feel that the future for this type of treatment is very bright, and it's really established a new platform, a new type of therapy that mesothelioma patients can benefit from.
And you do that while the surgery for removing the cancer to start with is taking place?
That's right. So once the surgery to remove the tumor, which may either be removing the tumor off the lung, what's called a pleurectomy, or it might be actually removing the entire lung, the extrapleural pneumonectomy. Either one of those procedures, as long as it reduces the disease to a microscopic level, meaning we can't see any left, is a starting point to then, at that time, during the surgery, but after the removal, to give the heated chemotherapy, usually for an hour.
That's cutting edge.
That's cutting edge.
I'm going to brag on your family a little bit, because as I'm sitting here with Dr. David Sugarbaker, you have a brother, I think it's Paul.
Yes.
That's down in the D.C. area, and he's also dedicated his professional career to dealing with mesothelioma, but he deals mainly with peritoneal mesotheliomas, as I understand it.
That's right. He is a more of an abdominal surgeon and has taken this on. And we've learned a lot from him and from his research.
Yeah, so you both learned a lot from your dad.
That's exactly right.
One of the interesting things that I know you do at your session with your patients is you bring a survivor of mesothelioma in that you've treated here that has been part of your program. And they talk to the patients and tell them, whatever they may tell them. Will you share some of the concepts, some of the things that those survivors have said about the disease and about fighting the disease?
Well, I would say that when an individual who's been through the surgical treatment, the intraoperative chemotherapy, and whatever other treatments we may recommend after that, when they come in the room, they can transfer more information and more hope in a minute of talking than I can over the course of the hour. Because there's nothing like talking to someone who's been through the process and who can stand there and say, I'm 2 years out, I'm 3 years out, and this is what you're going to face, and it's certainly surmountable. And if you stick with the program and with the coaching, there's a real chance to win. An individual who's been through it, who's standing there telling his or her story, is a very effective way to let people know there is hope, and that certainly it's not hopeless.
Dr. Sugarbaker, in your efforts to promote the patient education, what's one thing that you can just tell a patient that they need to keep in mind as they're dealing with this disease?
Well, Joe, that is anything is possible. And long-term survival is possible. It has been done before and is being done frequently at a number of different programs, including ours. And the 5-year survival has gone from 0 20 years ago to really a substantial number of patients living 5 years. The most important thing that patients need to understand is that they really need to get in a positive frame of mind. And one of the things that we focus on in this session before they're actually seen individually is the importance of that mindset, a winning mindset. And I liken it many times to some of the major sports like football. If you were playing the Super Bowl and you didn't believe you could win, well, it'd be tough to win, wouldn't it? Particularly if the other side had a different idea. Out there in the world, people say, and you'll hear it all the time, I'll believe it when I see it. Here in medicine, many times it really is, I'll see it when I believe it. And getting into that frame of mind to understand that anything is possible is part of our overall strategy with the initial patient education, many times talking to patients who've been through the program.
Doctor, I want to thank you for the time that you've given me today, and I also want to thank you for the time that you've come down to Charleston and spent with my attorneys educating them on mesothelioma and on what the science is learning, and to make them better lawyers in the courtroom for our clients. And we do appreciate that and appreciate your time and efforts. And we congratulate you on the successes you've had and wish you the best going forward with you and your colleagues here at Brigham and Women's.
Thank you very much for all your support and for coming up here today. We take every opportunity we can to help educate patients and what would be your clients with the possibilities. And in this disease, we now know anything is possible because we have patients who've even had bilateral disease alive 5, 6 years later. So anything's possible. You've got to stay positive.